Okay, my name is Jade. Today we are going to do a full head to toe assessment. This is Alex. We're gonna start out by assessing alert and orientedness. So I'm gonna ask, what is your full name?
Alex Lucky.
And where are you today?
In your room.
And what's today's date?
August 10th, 2023.
And who is the president?
Joe Biden.
And what are we doing today?
A full body assessment.
Perfect. So we're going to assess all of the cranial nerves. So cranial nerve number 1 is sense of smell. So I'm going to have Alex plug each nostril and we're going to present 2 different scents and she's going to close her eyes and we're going to see if she gets it right.
Citrus.
Yes. And
Mint.
Perfect. So those were right. Then cranial nerve number 2 is the Snellen chart, which you would have already completed in a history, which Alex is 2020. And then we have cranial nerves 3, 4, and 6, which is the eyes. So you're going to test eyelids and extraocular movements and pupil response. So can you blink your eyes for me? Perfect. Then can you follow my finger without moving your head? Awesome. And then we're going to look at the pupils and see if they constrict. They do, and then we're going to test for accommodation. So just follow my finger. Perfect. So that was 3, 4, and 6, and then we have 5 and 7, which is 5 and 7, which is the full face. So I'm going to have you wrinkle your face and smile and frown, and then I'm going to feel for sensation. And so we're going to close your eyes and just let me know if you feel this.
Yeah.
And then we're also going to make sure that 5 and 7 is the full face. And then this is also when we would do sharp and dull, which I don't have anything. And then along with the face is also just puffing up your cheeks. So if you just want to puff up your cheeks for me, perfect. So that was 5 and 7. And then we have 8, which is the ears. So we're going to test whispering in each ear while one is closed. And I'm just going to whisper a word and see if she can hear me.
Apple.
Perfect.
Orange.
Okay, so that is the ears. And then we are going to do 9, 10, and 12, which is the mouth. So if you can open your mouth for me, stick out your tongue, and this is also swallowing. So if you can just push your tongue. Perfect. And then swallow. And at this time I'm also going to do kind of like a mouth exam. So I'm also just going to assess for swallowing and feel she swallows. Then we're going to look at the tongue and the tonsils and the teeth and the pharynx. Say ah. And we're also going to, if we had a tongue depressor, we would test for the gag reflex, which we do not have today. So that was 9, 10, and 12. And all we have left is a 9, 10, and 12, 11, which is the shoulders. So if you could shrug your shoulders for me. And it's also the neck muscles, so if you could turn your head that way and push against my hand. Great. Perfect. So that was all with that. Now we are going to do, we're going to assess gait and the cerebellum for balance, all of those. So I'm going to have you stand up. And then close your eyes and stand on one foot and the other. Perfect. And then run your heel across your shin. Perfect. Okay, and then touch your fingers to your nose. Okay, and then go on your tippy toes and on your heels. And then walk heel to toe, which is assessing for scoliosis. That looks great. And then if you could sit back down for me, we're also going to assess rapid alternating movements. So if you could just do this on your, perfect, and then do your finger to thumb to fingers. Awesome. And that was all for the gait and balance. Now we are going to do a full assessment of the skin, the hair, and the extremities and everything. So I'm going to look at the hair, look at the texture, and if there's any pain or tenderness. No. Okay. Then we also look at the skin and the face. Looks great. And then we would do an ear exam. So we're gonna look and feel for any tenderness, pain.
No.
Okay. Then we're also gonna look at the tympanic membrane if you had a ear exam light and everything, and we would look at the ear canal. And then next we would look at the nose, and we're gonna look for any turbinates and any nasal drainage or a deviated septum. Looks great. Then we already did the mouth, so now we're gonna move to the neck, and we're gonna feel lymph nodes, tonsils, and the thyroid, which is normal, not enlarged, and make sure that the trachea is not deviated. And then we're going to move to the thorax. So first we're going to feel for CVA tenderness and any CVA tenderness, and I forgot the word. We'll keep going, I might remember. Okay. And then while we auscultate, what?
Scoliosis.
We already did that. CVA tenderness. What are those air-filled things? I forgot what they're called.
Air pockets.
No, there's a specific term for it. But now we're just gonna auscultate. So I'm gonna auscultate the carotid for any bruits, and we're gonna make sure carotid is there. We're gonna use the bell of our stethoscope. Sounds normal. And then we're gonna test for ergophony, bronchophony, and whisper pectoralogy. I think that's what it's called. And so I'm just gonna have Alex say E for ergophony and 99 for bronchophony. And then whisper 1, 2, 3 for me. Ready? Okay. 99.
99.
Perfect. One more time.
99.
Okay. Whisper 1, 2, 3. One more time. And E.
E.
Awesome. And then you're going to listen to the lungs, and we want to make sure you listen on the front and back, and we'll move with the vertebrae. Okay, lungs are clear. And then we're going to listen to the 5 cardiac points. So that is the aortic, pulmonic, herbs, tricuspid, and mitral. So we got the aortic, pulmonic, herbs, tricuspid, and mitral. And then that is all for the thoracic. So I'm just going to have you lay down. We are going to assess the abdomen. We're going to make sure it's flat. There's no abnormalities, any bumps or anything in the stomach. So first we're going to listen in all 4 quadrants for bowel sounds, and if you don't hear anything, you'll listen for another 5 minutes. We're also going to listen to the aorta. Okay. And then, look, this one stopped. Great. I'm glad we have it on there. Okay. And then we're going to percuss for the liver and the spleen. And then you're going to lightly palpate. If you feel any tenderness, please tell me. And then after that, we're going to deeply palpate for the spleen and the liver. So, do you have any tenderness?
No.
Okay. Then we'll deeply palpate. If you just take a deep breath, the liver is on this side. Perfect. And then the spleen is on this side. Perfect. Okay, so that is all for the abdominal assessment. If you could sit back down for me. Now we are going to assess the extremities, the arms, the pulses, and everything else. So we are just going to look at the skin. We're going to feel for the brachial pulses bilaterally, the popliteal, and we're also going to assess for any edema. Then we have the dorsal pedal pulse. Perfect. And then we're also going to assess strength. So if you could just push up for me. Great. And then do the same with your arms. Okay. And then we're also going to test Omen sign. So this is just checking for any DVTs. And there's none. And then if you let go and it wiggles, the foot wiggles, that's called clonus. Those look great. We're also going to assess for capillary refill, which is less than 3 seconds, so we're good. Then we're going to assess deep tendon reflexes. So we're going to first, I don't have a hammer, so we just have the bicep reflex, which is if you do here and tap, the arm will flex. Then we have the tricep. If we do it here, the arm will extend. Then we have the brachioradialis, which is here, and the hand would wiggles, and then you would do that on both sides. And then we have the patellar reflex, which is here, and the foot will extend. And then we have the Achilles reflex. You do it here, your heel will flex. So I think that's all. Thanks for watching.